Good afternoon, everybody, and welcome. We are just going to wait about another minute and we will start. I'm Zara, and I'm with Spinal Cord Injury Alberta, and I'll be your moderator for today. So as we wait for more people to join, if you can see on the screen here, just to remind you guys that the rehabilitation advice line is available to you. Please feel free to give them a call and they'll be able to help you. And it is available 7 days a week from 10 a.m. to 6 p.m. And we'll just go through a few housekeeping rules. Sorry, just 1 second here. And before we go through that, so once again, my name is Zara and I'm with Spinal Cord Injury Alberta. I'll be your moderator for today. Today's webinar is on bladder health and the ins and outs. We have 2 guest speakers today. One is Raj Parmar. She's a nurse practitioner with the Spinal Cord Injury Rehabilitation Program with the Department of Clinical Neurosciences. And Casey Ileo, who also works at the Foothills Hospital with Patient Liaison for Neurosciences. And to get into a few of the housekeeping rules, everyone will be muted. There will be a short presentation followed by discussion, and everyone is invited to share their views. We will monitor the chat box as well for any questions, comments, or anything like that. There will be poll questions throughout the webinar, so please make sure that you watch for your screen for the poll questions. You can change your name as well if you want and keep your video off during the webinar. And the webinar is recorded for the presentations, and we will turn it off when we do get to the discussions. So if you can take a few seconds here to complete the first poll question. So we will now continue with the presentation. And our first presenter is Raj Parmar with the Foothills Hospital, and she will do a short introduction.
Hey everyone, thank you for joining us. I'm Raj Parmar. I'm a nurse practitioner with Spinal Cord Injury Program at Foothills Hospital. I just want to start by saying what nurse practitioners do. Some people confuse if we're doctors or if we're nurses. So I am a nurse, a registered nurse with a master's degree in nursing, and then have gone back to school for further studying to get my NP designation as well. So as nurse practitioners, I am able to assess, prescribe, and diagnose patients with spinal cord injury. And I've been working with the spinal cord injury program since 2007. However, as nurse practitioner since 2016. So I think I have a fair bit of experience working with spinal cord injury population and knows ins and outs of the bladder health. So we will start chatting about the bladder health in general. So most of you guys have been living with spinal cord damage in some sort that has caused neurogenic bladder. So I'll just step back a little bit to talk about what our bladder does. Our bladder has two main functions. One is it stores the urine under low pressure, and the second, it helps to empty the bladder at the regular intervals under low pressure. I think the low pressure is the key. Zara, can you go back to the previous screen? Thank you. My first screen, yeah, thanks. So the main function for the bladder management is making sure we keep the kidneys healthy. And so the bladder management program is going to be different for everyone, depending on their level of injury and your circumstances at home. And so we make sure we consider all those things when we're creating a bladder management plan. The main goals for bladder management are, like I mentioned earlier, making sure the kidneys remain healthy and prevent bladder infections, avoid any incontinence or triggering, and provide independence, whatever the plan we choose for you, with you. And the goal always is so you're independent with that bladder management plan. Next slide. So everyone will have a different ways of emptying their bladder. The common ones are Foley catheter or suprapubic catheter. Foley catheter is the catheter that stays in the urethra, and suprapubic catheter is a creation that we do through the abdominal wall so that we can free up the urethra. And another one, some might be doing in and out catheter, which is called intermittent catheter, or other people might be using a combination. They're able to void a bit, but not completely emptying their bladder. So the key always is completely emptying the bladder. So they might be using in and out catheter and voiding together. Or sometimes some people may be doing in and out catheter and using a catheter for the incontinence management, for example, a condom catheter. Next slide. So the main concern when we're dealing with the bladder management is around bladder infections. So people would get with the spinal cord injury, that's really a common reason they will be coming back to the hospital. With urosepsis maybe is with a bladder infection. So it's really important. And most of you guys, I'm sure, have bladder infections and have had different symptoms. But this is the list, but not this is not the only list. You may have different symptoms you may get, but the main ones we normally go with is making sure checking the urine color and any cloudiness, or if it is the urine does have a smell, but it should not have a foul smell. If it is foul smelling urine, we always like you to go get it checked. And other symptoms may be like some people may have a burning sensation or just not feeling good, pain around their suprapubic region, or increased pain or spasms. If they had a pain and spasm or neuropathic pain, it goes through the roof as well when you have a bladder infection. And some people may just have their bladder, they were managing fairly good, and now all of a sudden they start getting leakage in between. And some people with elderly population, we find a lot of confusion as well. And when this infection spreads, takes over, goes to your kidneys, you may have more fever, chills, nausea, headache, and autonomic dysreflexia. I'm not going to go into autonomic dysreflexia a lot here, but maybe we can do another presentation on autonomic dysreflexia itself. It's more for people with a higher level of injuries. It's your body's way of telling you that something is wrong below the level of injury. Next slide. So the big question is, how do we prevent these bladder infections? These are just the basic things we teach everyone, and we hope that everyone continues with these things. Keep making sure you're keeping your supplies clean. If you're doing in and out catheters and reusing the catheter, make sure you're using soap and water to completely clean the catheters, and make sure it's dry before you reuse those catheters, and keeping your skin clean and using a proper technique to do in and out catheters. And then we look into other things. What can be done to make sure we prevent these infections? Is another one is we say like literally flushing your system, and we encourage everyone to drink 2 liters to 3 liters of fluid. So if you're doing in and out catheter, you should drink at least 2 liters of fluid, and making sure you're not letting the bladder volume to go beyond 500, and keeping the bladder volume around 500, and catheterizing at least every 6 hours. And if you have a suprapubic catheter or indwelling catheter, you should drink at least 3 liters of fluid. And when we talk about the fluid, I normally prefer water for the fluid, and you should avoid any caffeinated and bladder irritants drinks. And there's a list available for what is called bladder irritant. If you guys like to access that list, hopefully we will post it in our chats later on, but the link is on alberta.ca under AADLs. If you Google bladder irritants, you should be able to access that list. And another thing to prevent infections is making sure you're emptying your bladder regularly. Like I said earlier, make sure you're not letting it go beyond 6 hours. And everyone is going to have a different sign and symptoms of bladder infection. Know what your body's sign and symptoms are, and pay attention to that, and get help as soon as you can, because you cannot let it go too far, or you will end up with kidney infections as well. And then other couple things is making sure you're connected with a urologist and a physiatrist. And if you are connected with a physiatrist, we will make sure that you are connected with urology as well. But if you're living in a smaller community, we would like you to, get connected with a urologist as well. If you guys have any questions around that, I'll be more than happy to answer for you guys that. And another thing we do suggest is to prevent bladder infection is use of cranberries and D-mannose. These are extract of different berries that helps to reduce the infection rate. You may not find huge evidence on this, but the general consensus in our clinics, it has been that it's worked for this population. So what it does is it kind of provide more acidic environment in the bladder, and prevents the bacteria clinging to bladder wall. So it will not work if you're not drinking enough water. So the key again remains drinking enough water in combination with the cranberry and D-mannose to flush the bacteria out. Next slide. So could you damage your kidneys if you don't do a proper care? Yes, you can damage your kidneys, and our goal for our bladder management is making sure we save the kidneys. In the past, I'm talking in 70s, the people died from a lot of bladder or kidney infections. So the mortality was quite high in spinal cord injury because we didn't have enough good management for the bladder at that time. So now we have come a long way, making sure we're managing our bladder fairly good to prevent this kidney damage. So the things that could go wrong with the kidneys, there's quite a few things, but urosepsis or the bladder kidney infection would be one of the main things. And then the hydronephrosis, which is literally swelling of the kidney. You may not notice anything about that, but it could, if your bladder pressures are high, that could happen, that's why you need to be connected with either the physiatrist or the urologist, so we could monitor this every year. If you are connected with our clinic, we will make sure we do a kidney and bladder ultrasound yearly, which will pick on this hydronephrosis. And the other things they will pick on is any stones or any tumors or anything growing in the bladder. And when you go see a urologist yearly, they will check your bladder pressure and look inside the bladder as well to make sure bladder is healthy. Next slide. So then I thought we should just check a little bit quickly what kind of catheters are available in the community, because that does come up quite often in our clinic if there's anything new had come up with the catheters. So there's the three main type of catheters that are available. As you may know, if you have indwelling or suprapubic catheter, you would be using indwelling catheter. And then there are intermittent catheters and the external catheters, the condom catheters. Condom catheters are not the mainstream for our management. It's more for incontinence management. We normally don't like these catheters because it may cause more infections, as it will collect the urine and the bacteria will accumulate at the penis tip and cause more infections. But if you, for your lifestyle, if it works, that's good. And if you're having no bladder infection, it's okay to use those ones. Next slide. So intermittent catheters, the main ones you will see is the clear catheters, and they come in different types as well. Some come a little bit softer and others might be stiff, and that's your personal preference. Whatever you choose, you can use those catheters. And then there is red rubber. I don't think they're made anymore, but if you're using those we do not like to reuse those ones, and normally they're not as liked by the medical team. So they do cause a few infections as well. Next slide. So then there are catheters that are hydrophilic pre-lubricated catheters. Hydrophilic catheters are they're pre-lubricated catheters, but the gel they use in this one is has same pH level as your body's pH level, and evidence has shown that these catheters do reduce bladder infections, and the lubricated catheter has the lubricant that you would use for your day-to-day in and out catheters. So there's not a huge evidence showing that they cause less bladder infections, but they are quite convenient for use. Next slide. So the only thing I would say on those, the last slide is both kind of those catheters are not covered by AADL, but you may want to look into your private insurance and you may have some coverage in that area. And then there are closed system in and out catheters, which I would normally suggest for travel use. Like if you're especially traveling, doing a road trip, these are fairly good because they're pre-lubricated and comes with the bag that you can drain your bladder into the bag. Next slide. So the Foley catheters, there are few different kinds of Foleys available. Most of you guys are aware about the latex one. That's it's really porous, and we do not like to use for long term because it will cause more infections just because it's being so porous. And then there are latex with silicone coating. Some people do not like silicone catheter. They may choose to go with a latex catheter with a silicone coating. And 100% silicone catheters are more preferred for long-term use, and they cause less bladder infection. And all three of these catheters are covered through Alberta Aids to Daily Living. And that silver-coated catheter is a separate category. If you're having a lot of bladder infections, sometimes we have had tried these catheters, and they do work with the bladder infections to reduce the bladder infection rate. Next slide. I guess that is all for me.
Thank you so much, Raj. And just a reminder, there is a chat box if you guys have any questions that you want to ask along the way. We will now take a few seconds here to complete the second poll question. Thank you again, Raj, for your wonderful presentation. I will now pass it over to Casey. And Casey will introduce herself in just a second here.
Thank you, Zara. Hello, everybody. My name is Casey IL, and I am currently working as the patient liaison up at Foothills Hospital here in Calgary, and part of the team, that same team, sorry, as Raj, the Department of Clinical Neurosciences. I had my injury in 1999, which, like, I am always still kind of blown away by the fact that I am 20 years post-injury. So 20 years ago in Fernie, I was snowboarding and I fell and I broke my neck. I have a C6-7 level injury. But since then, in the past 20 years, I'm actually a new mom, new-ish mom. I have a 6-year-old son, and I've tried more than a handful of adaptive sports out there. That's kind of my thing. It's just I love being active, and I love food, huge food lover, love traveling. And this is a really cool picture of me this summer out in Fernie riding some trails out on my new adaptive mountain bike. I just wanted to thank Raj and SCI Alberta for asking me to be part of this. I feel very grateful and yeah, just excited to be involved. When I was first injured, I never in a million years thought I'd ever be speaking about having a neurogenic bladder, but here we are today. So when I was first injured, I was doing the in and out catheters, and I left the hospital doing that. And I did that for about 2 years. And, you know, for me, I needed to make a change just for my lifestyle and my quality of life. I found myself, you know, peeing my pants quite a bit, going to school, and just always really worrying about, is there going to be a bathroom I can get into there? And, you know, how much water can I drink? And it was just, for me, it was a lot. So I made the choice to move and use a Foley or indwelling catheter. And for me, that was just a huge sense of freedom. I could drink as much water as I wanted. I could drink the amount of water I needed to stay healthy and not have to worry about peeing my pants or being able to get into bathrooms. So that was very liberating for me, and that's why I made that choice. I used a Foley indwelling catheter for about 17 years until I had a really great chat with my friend Brandis, who also works for Spinal Cord Injury Alberta, and she introduced me to what's called a suprapubic catheter. So she sold me on that. No, it was just interesting. It was just different, right? It's a hole that's punched in through just a few inches above my pubic bone, right into the bladder. It still uses an indwelling catheter, and I still drain into a bag, but it's just kind of out of the way from all my other business. So it was very, again, eye-opening, life-changing, super glad that I had that conversation, but still kind of just blown away that it took me 17 years post-injury to find out about this incredible life-changing procedure. So had I known earlier, I would have probably done that a lot earlier, but I didn't. But I'm still happy with my decision to move that way. I've had that now for about 2.5 years, and I absolutely love it. I wouldn't go back. I think for me, the biggest thing was, you know, if this didn't work out for me, the suprapubic catheter didn't work out for me, it's totally reversible. You know, the hole will close up quite quickly, and I could go back to doing what I was doing. Initially, when I first started using catheters, and even up until, you know, I think 13 years post-injury,